Okay, we are now out of motions and into petitions. The member from Oak Ridges, Markham. Market Aurora. Going somewhere I shouldn't have been. Newmarket Aurora.
Thank you, Speaker. I have a petition here that deals with youth mental health in our schools and communities, addressed to the Legislative Assembly of Ontario. Whereas youth mental health in the province of Ontario is rising at an alarming rate. According to the Centre for Addiction and Mental Health, 70% of mental health problems and illnesses have their onset during childhood or adolescence. Research shows that early identification leads to improved outcomes. Whereas pursuant to the Ontario Ministry of Children and Youth Services, studies suggest 15 to 21% of children and youth, approximately 467,000 to 654,000 children and youth in Ontario, have at least one mental health disorder. The consequences can affect children and youth now and into adulthood, their families, caregivers, schools, communities, employers, and the province as a whole. Whereas the 2010 Ontario report by the Select Committee on Mental Health and Addictions, entitled Navigating the Journey to Wellness, the Comprehensive Mental Health and Addictions Action Plan for Ontarians, made specific recommendations that would address the growing mental health and addiction crisis among youth in the province, but no further concrete steps have been taken. Whereas waiting lists for help are at a crisis level, and our schools do not have the resources to deal with the growing incidence of bullying, addiction, anxiety, depression, and suicide, education and awareness is critical to remove the stigma. Therefore, we, the undersigned, petition the Legislative Assembly of Ontario to prioritize funding and resources for our schools and communities to help our youth with mental health and addiction illnesses and the resulting consequences. And, Speaker, I'm pleased to affix my signature in support of this petition.
Petitions. Member